health alert, a measles warning issued in Central Florida. Health officials sending out this alert to make sure our area does not become home of the next measles outbreak.
Because of all the international visitors we have that come to this area of Central Florida, it's certainly wise to be vaccinated.
Outbreaks in New York State continue to drive up the number of measles cases in the U.S., which are approaching levels not seen in 25 years. According to the Florida Department of Health, there's only one confirmed case of the measles in the state of Florida. It's in South Florida, but that one person exposed 138 others.
Individual who's infected with measles coughs or sneezes, the particles or the germs itself can be active in the air up to 2 hours.
So how can you protect yourself and your family? Well, that's the question, because folks are worried about it. We want to bring in the Fox Medical Team's Dr. Joe this morning. She's talking a little bit about the travel issue, because that's obviously a big problem. Everybody comes to Florida, and now we're really starting to get into the thick of travel season.
No, that's absolutely true. And if we look historically, in 2015, there was a case, a child or a person that we don't know who that was, who went to Disneyland. From that, 147 more cases occurred in multiple states based on that one particular person, and they could trace that back because they could look at the genetic fingerprint of the virus, and they traced that back to a strain that was in the Philippines. So we do have this concern when we bring in individuals who may have the measles, who may be infectious, and again, they're infectious 4 days before that rash ever breaks out. And then we also have to remember too, when people have these travel plans, a lot of these people save up for months and months and months, and then if their child gets sick, well, a lot of times they come anyway. So we have to really be alert, and I think we have to be vigilant here in the state of Florida to make sure as many people are vaccinated as possible, because if an unvaccinated person comes into contact with one of those people carrying that virus, there's about a 90% transmission rate. And you also just heard, if that person coughs or sneezes, leaves the area, the next person walks into that space, they can still get infected.
All right, so Dr. Joe, here's the other problem that a lot of folks are facing. What if you did get vaccinated? Do you need a booster? How does that work?
Well, yes, sometimes you do. Now, right now, they're saying that adults that have had at least one vaccine are probably okay, but there is a caveat to that. There are certain individuals who are considered unvaccinated even though they had the vaccine. Super complicated, hard for people to know, but generally speaking, we're looking at people probably that were vaccinated in the 60s. We may be looking at people especially between 1963 and 1967. By 1975, the new vaccine came out. So prior to that, people who might have gotten that first dose or their only dose might not be protected. We also worry about individuals who may have been vaccinated before they turned one and were never vaccinated again, also considered unvaccinated, and people that got something called immunoglobulin, considered unvaccinated. There's really no way for us to know as adults a lot of times, unless we can maybe get our medical records. Sometimes you can see some of your shot histories on your college applications, but a lot of times we don't know. Now, there are individuals who are encouraged to get that booster. Those are going to be people in a healthcare setting, or people that maybe are going to a college or someplace where they may be exposed more readily to the virus, and people that are traveling internationally. Here is another caveat. Children don't get the MMR vaccine until age 12 months to 15 months. If you are traveling overseas to an area with an outbreak, and there are lots of them out there, that child needs to get vaccinated as early as the age of 6 months. Now, when they return back, they'll still have to get 2 more shots, the last one up until age, I think, 4 to 6. So that's really another important thing that people need to know, especially if you've got plans to travel overseas or even South America, Europe. I mean, there's lots of countries with outbreaks. Make sure you check the CDC's website so you can get vaccinated before those summer travel plans take place.
Yeah, it's very good advice. Do your research before you go. Dr. Joe, thank you so much.
Thank you.